So hi, I'm Jess.
And I'm Lucas.
And welcome to another episode of Dose of Pharma. Today we are joined by Lily Tuong, who is a graduate of the Bachelor of Pharmaceutical Science and now works as a forensic toxicologist. And we'll be discussing what it's like to change career fields and, of course, forensics. So to begin, Lily, would you be able to tell us a bit about yourself?
Hi, everyone. So my name is Lily. I graduated from Pharma at Monash back in, I can't remember what year, 2016, in third year. That was my third year. After third year, Laurence organized these like summer scholarships. I don't know if you guys still have them. Do you guys still have like summer internships kind of thing? Yeah, I did a summer internship after third year at Eureka Ag Research. So that was like 3 months. After that, I went into to do honors, and throughout, like during honors, I was also working at Eureka part-time. And after honors, I decided to go into, working full-time. So I went to work at Eureka full-time. I was at Eureka for a little bit, and then I decided to branch off into a different field. So I went into at toxicology in Victorian Institute of Forensic Medicine, and that's where I am now. I was a technical officer for 2 years, and now I am a scientist for nearly a year.
So what drew you towards forensics?
To be honest, I didn't know I'd end up in forensics. I always enjoyed, watching NCIS and Law and Order and that kind of thing. Wasn't expecting forensics to be what it was. I just saw it because I went into it because it was an analytical job, and I really like analytical science, liquid chromatography, all that kind of thing. Yeah, I went into the field, and I didn't want a boring like any other analytical job because it's just routine over and over again. So it gets kind of repetitive and boring. But with forensics, it's like each case is different, and, it's always interesting trying to solve the case, being a small part of a death investigation. So that's always interesting. Yeah.
How did you incorporate the pharm-sci knowledge into your job? Was it apart from the laboratory skills, were there anything that was really important that you were able to transfer into your new role?
I think there's a lot of things that transfers into the new role, like teamwork, communication in all the group kind of projects that you guys do. Things like multitasking and organization skills. That's kind of like personal skills you already have, but you develop that more. In terms of analytical side, the unit like HPLC, that's helped me a lot, knowing the background knowledge of what all the analytical techniques that we do. Even things like, I remember I don't know if you guys heard it, but there was that toxicology unit, in second year or something, that was kind of helpful. I still remember things from that unit. So that was a small part of toxicology, and things like even pharmacology, just knowing the background and how drug interactions work, things like that, volume of distribution, all that kind of things, that I've taken all that into what I do now, pretty much. Yeah.
Yeah, I think there's a third year elective now you can choose to do toxicology.
Oh, cool. Yeah, wow, okay.
It's good that so much of the stuff you've learned in the course is really applicable to what you're doing.
It's background stuff that you know, that you don't even know that you know. It's it's just there kind of thing. Does that make sense? Yeah. You just take it with you, whatever you learned during uni. You might not remember everything, but you can always freshen up those skills and whatnot. Yeah.
It's definitely a lot easier to relearn it if you've already learned it once rather than having to learn it from scratch.
During uni, just understand the main concepts, and you'll carry it with you. You'll pick it up again, and it's oh yeah, I remember that kind of thing. And yeah.
You mentioned earlier that you were really into NCIS and those kind of shows. Is your job how the movies portrays that? Or is it very different and they get everything wrong?
I get asked that. I'm someone asked me, oh, what do you work in? I'm forensics. And they're oh, is it NCIS? I always get asked that question. So there's aspects of it, I guess you can say, is real. There's, a crime, there's a death, there's an investigation, tests get done, you go to court, things like that, all those main concepts. It's yeah, that's true. But in reality, with testing, like in NCIS, how Abby, she's like the one person that does all the tests. That's one part that's not real. Like there's everyone as a forensic scientist, there's like different fields you can do. Like I'm in toxicology, there's like DNA, there's fingerprinting, ballistics, all that kind of stuff. So yeah, it's not one person that does everything pretty much. Like no, yeah. With the testing, like on the show, it's like, oh, run this test and here's the result. Yeah, it's like within a few hours or whatnot. That's not true. Like there's policies and procedures in place. So you gotta, like when you get a result, you gotta write up a report, get the report sent to like a different person, and like it's a whole stream that goes down. So it's not like a case isn't solved within like a day or two kind of thing. Yeah.
Yeah, so that's a lot more involved than a show. But there's only so much you can fit into like a short TV episode.
Like a 40-minute episode. Yeah, that's like maybe even a year's case in a 40-minute episode. Yeah.
What does it look like on your like a day-to-day basis on your role in your role?
It really depends, right? Because I'm still learning like a lot of new assays, like techniques, analytical techniques and stuff. So right now I pretty much know the bare minimum. My usual day is coming if I'm extracting that day. So I have samples, I extract the samples. By the end of the day, I put it on the instrument. And then the next day I'll just go through the data pretty much and just, yeah, that's my usual day. And then in between there's all, like if you can write reports, there's report writing, and there's just other tasks around the labs to do too. Yeah.
What kind of methods do you use? Do you use like HPLC or like what kind of analysis do you do?
So in the lab, we have liquid chromatography, we have gas chromatography. That's the main one. And we have immunoassays too. So that's just the screening before we put it onto the quantitation. Yeah, so that's, but right now I only know, I know liquid chromatography and a bit of gas chromatography. Yeah.
So when you're analyzing a sample, do you just like run it through there? Then do you have like standard you compare it to? Like, how do you go about like analyzing a sample and making a conclusion?
Yeah, so usually, so we have assays. So that's like we test, like one assay is testing, drugs of abuse in urine. Another one would be drugs of abuse in blood. We have drugs and poisons. We have a lot of different assays. So for one assay, you have a set of standards. You have your quality controls in between like a few cases. So you can see how your run's going through. So the sample is, we analyze the sample. It's not just one sample at a time. It's a whole batch of it. We have like a required minimum of how many samples we run per assay kind of thing. Yeah.
So do you have the most interesting case that you've worked on?
Oh, there's always interesting cases, but I can't share that kind of detail. Yeah, sorry, it's all confidential. I'm not allowed to mention any cases. Yeah.
No, I definitely understand that.
So actually I want to ask, like, what kind of cases do you usually encounter? Is it like usual small cases like car accidents, or is it like very, those murder cases?
Yeah. So at VIFM in the toxicology department, we do coronal investigations. So pretty much all the cases that are reported to Coronal where like doctors don't want to they don't want to sign off on a death certificate, things like that, and they want a further investigation to find the cause of death. We also do cases for Victoria Police too. So like, the oral fluid taken on the roadsides and things like that too. So that's our two main stakeholders where we work for. So to answer your question, like most of the time it's like a natural death. What I mentioned before, they don't want to sign off on it. That's most of the time, but we get all kinds of cases like motor vehicle accidents, suicides, homicides. We get a whole range of cases. Yeah.
Why is it like usually you have to do is it like an autopsy for like the natural deaths, or?
That depends too. I'm not too sure about the whole process, but we have what's an overnight tox. So sometimes the body of the deceased comes in and we get a blood sample and we run to see if it needs further testing, and whether or not it needs further testing, or like if the toxicology results are conclusive, they don't need to take them like to autopsy. But in other cases, I think it's like when the family don't want an autopsy to happen, but they want to like try to still figure out the cause of death. We can do toxicology in that too to try and figure out if any drugs were the cause of death for that too.
Sounds like a very unique field. Were you worried about changing from like the agricultural industry into forensics? That seems like a big jump.
Yeah, I was, but like with toxicology, I was like, maybe I can like bring something like some knowledge from my farm side, like something from farm side that I would understand like things better. But with like the job, you like, I guess with any job too, you learn on the job too. So it's not like you have some sort of background knowledge, but most of the time you learn on the job too. So it's not too stressful in that aspect. Yeah.
Have you ever gotten like squeamish on the job? Or is it like just mostly in the lab and you just work with the samples?
Sometimes you get pretty gross samples. I'm not going to lie. Yeah. Yeah. Sometimes you get maggots and things like that. So you get a bit squeamish about that. And yeah, but you get used to it. I think it's like, it comes with the job. Yeah. The more you see exposed to something, you're like, okay, I can handle this. Yeah. I think when I first started, like one of what we get usually is like stomach contents, because that's where we can find like in cases where like drug overdoses and like things like that. When I first like saw stomach content, I'm like, oh, that's so gross. Oh, like, oh, yuck. Yeah. But now it's like you just get used to it kind of thing.
Yeah, it's just another day at work.
Yeah, pretty much. Just casually analyzing some stomach contents. Yeah.
Yeah, so is this like not a place you thought you'd end up when you were like doing your internships in like the agricultural industry?
Yeah. I didn't even know like this place existed kind of thing. Yeah.
Do you have any advice for people who are considering changing fields?
Just go for it. Like, don't be scared. If you're not like 100% like committed in one like field, or you're like a bit iffy, you want to explore, like just go for it. Don't hesitate. Yeah, if anything happens, you can always find a similar job to your old one. You can't go back to your old one, obviously, but yeah, just go for it. And if you don't like that job, go for another job. Like, yeah, I think when I was back in uni, it's kind of like, oh, I need to be stuck in that one job forever kind of thing. I need to find the job I like and be stuck in that, because I was like, shouldn't be jumping around industries and things like that. But I think you need to jump around to find the one that you love and you enjoy doing. Yeah.
Yeah, definitely. Because like you don't know what you don't know unless you try.
Yeah, exactly. You got to try it out. You can always go to another job. Yeah.
So do you see yourself continuing this career pathway in the forensic science industry, or are you like on the lookout for like something more like different, interesting?
So like I've only been a scientist for like a year now at VFM, so it's pretty new.
Yeah.
I still have like heaps to learn. I still have like, so I'm like pretty set right now, like where I am in my career. Like I'm pretty happy with the job that I have.
Do you think you'll move to like higher roles within that job, or like just keep working as a scientist?
Yeah, definitely. Like the higher roles are like what higher up is scientist, but you look at other like more, you do more testing and you have more responsibilities kind of thing. And when you move up again, it's like you're a senior scientist, toxicologist pretty much.
Oh yeah, so there's plenty of room for career progression, which is pretty promising.
Yeah, that's why it's kind of like I'm kind of happy where I am. There's room for progression and it's pretty secure too, because it's a government job. So I'm happy with that too.
Are there like other departments apart from like toxicology?
Yeah, there's so at the Victorian Institute of Forensic Medicine, there's we have, for the field of like forensic sciences, we have us, toxicology, we have histology, and we have molecular biology. But like as VFM as a whole, there's the mortuary staff, technicians, there's pathologists, we have clinical forensic medicine. There's there's a lot of other departments within VFM.
It's quite a large team.
Yeah. But most of the forensics actually happens at Victoria Police. That's at the McLeod Victoria Police Services. So that's like where all the DNA ballistics, all that kind of stuff happens there.
So do you have to work between the teams a lot of the time? Like, is there a lot of communication between the different like forensic teams?
Is that within VIFM or you're talking about?
Yeah, like within VIFM and probably externally as well.
Yeah, because with all the cases that we do, there's like each case, it's like you get all the other forensic services, they put up results for whatever they do too. We don't like necessarily know what they do, but we don't have too much involvement with them.
Yeah, so it's more like in your own team, that kind of like teamwork.
Yeah. Like you do communicate with the pathologist. Usually it goes through, like we get results, we send it off to pathologists. They probably get results and send it off to pathologists too. And that's more of the communication in between that we do.
Yeah, it's pretty different than a lot of like industries I've heard that like pharmaceutical science working in. A lot of the industries I've heard they have to communicate between departments a lot and they have to spend days in meetings.
Yeah.
So that must be appealing for some people to not have to do that as much.
Yeah, so I don't do too many meetings and things like that. So I'm happy with that.
Yeah, that sounds good.
Yeah, it's nice to have a hands-on role and like work at your own pace. Can you tell us a little bit about like what excites you the most about your role?
I don't know, everything about the job. I think the main thing is that it's rewarding. Like what you do is like helping someone out there. Like for every case, you're doing some toxicology reports, toxicology testing. Sorry, you're helping with a death investigation, and that's also helping the community, and it's also helping the family members try to grieve and everything. And with the Victoria Police work, we take drivers who are under the influence off the road. So that's really rewarding. Like if you think of it like that, the work matters, and that's something that I find like really rewarding about the job. And with the job too, we also like, it's not just, we do routine testing all the time, but there's also like a research aspect too. So like, as you know, science is always growing. It's getting like, it's evolving all the time. So we're also doing a lot of research, drug intel projects where we're helping, the government try to see what other drugs of abuse, if they should incorporate into the legislation, things like that.
Well, that's fascinating. I had no idea that there was like a research component to jobs like that.
Yeah, like we have a main research guy, and we also have like I think it's the forensic medicine, like the actual Monash. The Monash, it's actually at VIFM, the forensic course. Yeah, it's actually at VIFM too. So there's like PhD students that come up to do method development in the lab, and there's honors students. So yeah, there's a whole research aspect to it too. So there's always like personal development going on. There's always like lunchtime lectures where we go down and different PhD students from different departments and things like that, they present like what they're learning, their findings. So it's always interesting.
Wow.
Oh, that's so cool.
It's great that you're able to like learn and gain more knowledge while you're on the job as well.
Yeah. Like I think most roles out there, it's like you're doing the same testing like all the time, the routine testing, and there's nothing else to it. That's why, like when I first graduated uni, I was like, oh, I don't really want to go into like quality control analytical because it sounds kind of boring. You're doing the same stuff every day. I want to go into formulation science or like something like as a formulator. But yeah, when I found like an in-between now, so like I'm really happy with where I am.
Yeah, it sounds like a great balance of like knowing what to expect to an extent that you're not like completely thrown off, but also having it change up enough that it's interesting still.
Yeah, like you won't get bored. If you get bored, you like do some research or something like that. Yeah.
Yeah, it's a nice blend of like research and industry. Unlike other industries we've came across, they're very like fast paced and work driven.
Yeah, I've heard that. It's always like pushing out output. It's all about, the money. It's that most of the field is like that. So it's good working somewhere where it's like the work matters.
Yeah. You mentioned that like there's like PhD students at Monash who like come into like where you were. Would that be an option for people who graduate from Bachelors of Pharmaceutical Science to go into a PhD, like one of those PhD programs?
Yeah, it's always an option, I guess. You just have to get in touch with the right people. I think that's always an option. Yeah, I think you just got to get in contact with Monash, forensic science, I guess. Not forensics, forensic medicine, sorry, it's that course. And I'm sure you'll be able to find more sources and things like that. A lot of people from my work have actually graduated from pharmaceutical science at RMIT. Like most of them,
wow.
they do their placement unit at RMIT is at VIFM. Like we take one student a year doing, the whole year's worth of honours project.
Yeah, so it's definitely like a very viable career pathway for people in like the pharmaceutical science course.
Yeah, I think so. Yeah, I wouldn't say no. It's always worth a try to try and get in touch with the right people. You won't know until you try, right?
Yeah. No, that's been a great message. Like you've been giving out throughout this whole thing. It's like you just got to go for it and try.
Just go for it. Yeah, life's too short, you know. We've got COVID going on. We don't know what's going to happen next, you know.
Yeah. Just to sum it up, Lily, what kind of advice would you give to pharmaceutical science students or like people who are very interested in forensic science? Like, what should they do to prepare for the job, or like who should they get in contact with to like step their first foot in?
Yeah, I think with these jobs, because they're government based, they're always like, you just got to check the Vic Careers website. Like there's always jobs that's advertised, like, but you just got to like check vigorously, like all the time, if you want to get into the field, or know someone that like when a job's advertised in that department, they'll tell you about it, like personally. For me, I started when I applied for this job, there was 2 roles available. So it was technical officer and scientist. I started from like the bottom, like just like the tech. I took the tech role because I was like, I might not get the scientist role because I don't know too much. So I just started there and just worked my way up. That's always more of a guarantee than going straight into scientist and getting rejected for the job kind of thing. Yeah. So you just got to keep a lookout for the job and just go for the job, I guess.
Thank you very much.
Yeah, I hope that answered the question.
Yeah. It's the importance of getting your foot in the door and getting experience.
Yeah, exactly. Just getting your foot in the door, and I guess any experience. If you're in like whatever field, just get some experience. So then you have some like lab experience, because I know a lot of jobs out there it's always like you need a minimum of 5 years experience when you just graduated from uni, and you're like, does 3 years of a course count? Yeah. So, and sometimes with like, I think jobs out there where it's like 5 years minimum, you just got to like, just go for it too. You never know if you might get it.
Yeah, so thank you for answering all our questions. It was definitely very intriguing. And we'll keep it in mind when we're watching the NCIS next.
It's not all real, you know. Someone, you probably already know that. Yeah.
To conclude the episode, we wish to acknowledge the people of the Kulin Nations on whose land we are gathered today. We pay our respects to the elders past, present and emerging. For those listening who may be based elsewhere, we pay our respects to the traditional owners of the land from wherever you may be listening from. We especially welcome any Aboriginal or Torres Strait Islander people listening in today.